Our brains are made mostly of fat, so why not nourish them with the highest quality omega-3s available? Omega-3 Rejuvenate from Big Bold Health. Omega-3 Rejuvenate is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. This is not the story of other brands. The fact is, most of the world's fish oil products are produced from several types of species packed into nets in commercial fishing zones, loaded into the holds of vessels that stay out for days or even weeks, and put in processing plants that treat them with high heat, chemicals, and synthetic nutrients. Big Bold Health does it differently. All of it straight from the sea into the hands of skilled fishermen, instantly flash frozen and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique low-temperature extraction preserves the natural goodness of the fish so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman20 for 20% off site-wide. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. We're talking to board-certified allergist immunologist Dr. Dean Mitchell, who practices here in New York. And he also is the author of a great new book, Conquering Candida, the new 30-day protocol for restoring your microbiome and health. And what it represents is an updating of something that we've been talking about for a long time, that was actually introduced in the 1980s when I began practicing, which is the yeast connection, so-called Candida, that is something that initially was thought to be heresy. It was quackery to talk about Candida or yeast as being a contributing cause to patients' malaise. But Dr. Mitchell, what are some of the symptoms that might alert a person to the possibility that they might have a Candida overgrowth?
So it is varied, and I think that's what Dr. Hoffman really threw doctors off. I think the thinking's changed.
It's so varied and non-specific, it could be anything, right?
Well, but this is the thing, too. You know, I think for a long time, doctors didn't like when someone had multiple symptoms, which sounds silly.
Mm-hmm.
Again, a person came in complaining, I have bloating, I have constipation, I get rashes, I get migraines. And all of a sudden the doctor's head's spinning.
Wait a minute. What's your chief complaint?
Right,
we're taught in medicine to elicit the chief complaint. Like, don't give me all this extraneous stuff.
One complaint, one or two the most.
Right. Per visit.
And the other thing was that, and typically also too, so think about it, like you go to see the GI doctor and you complain about bloating, constipation, reflux, and then you say, I got these rashes too, or I have migraines, and the doctor says, I don't care about that. Go see the neurologist. Go see your dermatologist. So all of this,
or worse yet, see a psychiatrist, because with all those complaints,
that was great. And the thing is that again, that's where Dr. Bassano's work with celiac disease was so illuminating, because again, I'm probably with yourself too. When I was in medical school and I did my pediatrics rotation, there was about 2 paragraphs on celiac disease, and it showed these little children that were failing to thrive, that didn't grow well, and had big bellies.
Yeah, they looked like they were from Biafra,
right.
Like starvation victims.
Something like not heard of, know?
Right.
And it really wasn't until I was in practice, again in the 1990s, that I started to see my first cases of celiac, and some of them had no GI symptoms at all.
Yeah.
And that was eye-opening. But celiac and Dr. Bassano's work opened up this whole idea that symptoms that even start in the gut doesn't necessarily stay in the gut and can cause other systemic, presentations. And again, going back to what we talked to before, earlier on the podcast, that I've sort of staged this with Candida, even though it doesn't have to be the exact order, but a lot of them I'll get the history. Something GI was going on initially. Mm-hmm. Then the second stage is it could be skin, it could be sinus or vaginal yeast, mucous membrane type of things. Then the third, the deeper stages, the patients could get the brain fog. And then the fourth stages, which a lot of times was when I would see the patient, they were deep in, and we could get them better, but it would be severe fatigue and sometimes like fibromyalgia symptoms. So it is a whole array of symptoms. And that's why I think the history is so important. And like yourself, I don't have an assistant or anybody take the history. I
Yeah.
do it myself because honestly, that's one of the things in medicine that art is being lost. Like a lot of places now, because of for time constraints or productivity, they have the assistant of the assistant taking the history. And I tell people, even though they fill out, hopefully I try to keep it small, like the 2, 3 pages of information that I want to have. I want to hear their history and the sequence of events. It's so important. And again, I think that's what helps
And you're being a
diagnose.
detective, in effect. You really are. Yeah.
Exactly. And the other frustrating thing for doctors and for patients, I will admit, is that there's not really a specific test for Candida. And I know that drives doctors crazy.
Exactly. I was going to mention that is that,
Yeah,
they say, show me the blood test
right.
because, we can
Right.
test
People
for
come in with-
viruses, we can do
right.
cultures for bacteria. And what if we get a stool test that shows Candida? That's kind of meaningless because
It
the
is.
presence of Candida is not that unusual.
Yeah. You know what I wanted? I've been begging the companies to try to develop with them is a breath test. Because
Okay.
just like SIBO, the same way we can diagnose
Mhm.
small intestinal bacterial overgrowth, I think for sure we could test that for SIFO, small intestinal fungal overgrowth, but nobody is
What would we
taking
test
up.
for? Like volatile
Yeah.
organic
Well, the
hydrocarbons
same
that are
way,
from
same way you do the breathalyzer, the cops do, to check alcohol. There would be other things that you could detect.
aldehydes and volatile
Aldehydes,
compounds.
sure.
Yeah.
And I think that would be helpful and maybe give more validity to the diagnosis. But we have to deal with what we have to deal with. And right now, it's still a very clinical diagnosis.
Like a breath metabolome, maybe with AI
Yeah, yeah,
analysis to see if it fits a pattern
sure.
that's suggests the diagnosis. But yeah, I agree with you that doctors, where's the evidence? Where's the proof?
I get
And
it.
it is often a presumptive diagnosis. And when you make a presumptive diagnosis, sometimes you treat as if, and if the patient gets better, you've nailed it. And if
That you know what you're saying exactly what I tell the patients because again when we have this whole conversation I listen to them and I say look I think based on everything you've told me you're highly likely to have Candida and they well how do you know and I say to them we'll know in 3 weeks because when I give you a 3 week course of antifungals if you respond 40-50% we're on the right track.
right, your book actually has some controversial views about probiotics.
Yes.
You're not the biggest fan of probiotics. One might think that, okay, if we take the right probiotics, we can crowd out the yeast, normalize the gastrointestinal tract. But you say maybe not.
Yeah. It's interesting. Over the years, being an immunologist and very interested in the microbiome, I didn't know the answer for a long time whether probiotics were good or bad. We all assume it's good because it sounds good. Like
Yeah.
probiotics in yogurts make all these Russians live to 100 years old. It's got to be good. And over the years, I actually tried probiotics myself. I didn't tolerate them well. And I found with the patients, it was like 50-50. Some patients said it's great, whatever, fine, keep taking it. I had other patients that go, I can't take it. It makes me feel worse. And what really changed my mind about this is two people I really respect a lot. Dr. Mark Pimentel, he's the
Hmm.
director of Pimentel Labs at
A
UCLA.
big SIBO
Really,
guy. He's a big SIBO
yes,
guy, right?
he's the one who discovered that IBS pretty much is due to SIBO, and Mark is
Small
just
intestine bacterial overgrowth. Yeah.
right. Mark is a super researcher, doctor, everything. And one of his colleagues, who I fortunately took a while to get a hold of, was Dr. Satish Rao in Georgia. He also is a gastroenterologist, and he's the one actually who did a lot of the work showing that so a lot of the cases that were in SIBO were SIFO, were due to Candida. So
Oh,
maybe
SIBO
both
and SIFO. Okay.
I had them on my
Fungal
podcast.
overgrowth.
Right. And what both of them have said by pointing to the literature showing that really probiotics have not been shown to be helpful in a lot of these cases. And one of the other ways that Dr. Pimentel explained it was that he goes, unfortunately, lactobacillus, which is again the one that's in so many probiotics, he calls it the bully. And he says it's the bully because even if it's a quote a good bacteria, it crowds out the other ones and it doesn't lead to that diversity that we're seeking.
Okay.
So I'm sure like yourself, I sometimes have to rely on the people I trust that I think are at the forefront. Dr. Pimentel's done a lot of research. If anybody goes to his website, he's shown how our microbiome changes with aging,
Mm-hmm.
from medications. I mean, I think eventually we're going to understand so much better, and that probiotics will be helpful at some point when we know what's the right combination and organisms to give.
So let's focus on another formulation, which in some ways is related to the yeast connection, but amplifies our understanding of why people have multi-system illnesses that are not just confined to, you're an allergist. And so, people think that just consists of sniffles, sneezes, wheezes, itches. I think I've named them all. Those are the superficial manifestations of allergy, but there's this concept of something called MCAS. So perhaps give us a primer on MCAS. We've actually done some podcasts on the subject of MCAS, but where does MCAS figure into this picture, and how does it expand our diagnostic and treatment options?
Yeah, it's another great question. It's the next book I'm working on.
Okay.
I've seen a lot of cases of that. Again, fortunately, my background put me in the right epicenter of all of this. But and it's kind of funny too, I'm smiling because, probably about 20% of my practice now are the simple allergy cases.
The minority now.
Minority, yeah. But now mast cell activation is actually a fairly large part of my practice. And I'll tell you how it ties into Candida and some other things. But what's really interesting, Dr. Hoffman, is this too. Again, going back, see, I love sometimes reflecting on my career or my teaching, because I remember in my allergy fellowship, I remember I had to do a presentation on mast cells, and it was very interesting learning about the different types and everything. And we basically focused that it was in mucous membranes, like in the sinuses and the lungs, and even the GI tract, even though that wasn't emphasized, and also the skin. So, because the analogy, we deal a lot with sinusitis, asthma, and dermatitis. But I remember thinking back over the years that, because mast cells and IgE were all associated with allergic patients, I was saying to myself, why would God invent this cell just to torture allergy patients? I mean, that would be very cruel, and I believe in a benevolent, creator. And then I got to tell you something. COVID changed the game completely. Because all of a sudden, during the COVID pandemic, unfortunately, I started to see in my practice these patients that had long-haul COVID that not only had their blood pressure fluctuating, all these crazy symptoms, a lot of them also were developing severe food allergies and intolerances, whatever you want to call them, that they were down to eating 4 foods. And it started to all come together. And also it was during this last decade that mast cell activation syndrome, MCAS, which was a controversial diagnosis like Candida. I must always land with these controversial diagnoses. So MCAS was really debated about being this is another one of those functional medicine made up diagnoses, whatever. Yeah. But it started to make sense, because what I tell my patients every day when I'm seeing them, I said, mast cells are a fascinating cell. They're really what we call a primary immune defender. They're a patrol cell. When you cut yourself on your hand, mast cells come in to help you heal. When you get an infection, mast cells are the first guys on the scene, and then they bring in the heavy-duty guys. So they're very important. But when they're constantly activated, then you get a lot of difficult symptoms. And that's been my challenge in practice, which I've been fortunate to work with some really top researchers on, is finding the right medications that stabilize the mast cells, not just antihistamines, which block the histamine, but stabilize the
right, because there's more to mast. A lot of people think with mast cells they release histamine, but they also release a whole panoply of compounds, hundreds of things.
Hundreds. Yeah. I make the analogy too. I'm giving away a little thing from my book. When I try to explain this to patients, I tell them, picture a glass of water on a table and make believe that the water is filled with histamine. Basically like an analogy to ourselves. If the table shakes and the water spills, right, and like on my desk, and then I'm busy getting paper towels to dry up what's spilled, that's like antihistamines. That's how they work. But what if I have something which I can make compounded that stabilizes the glass so it doesn't spill over? I said, that's what we're trying to do. But even beyond that, the work that I do, and again, in my background dealing with toxic mold and allergies, is also try to find out, or Candida, what's the underlying trigger? Because any inflammation is going to trigger those mast cells.
Or it could be an infection, as with COVID, or even a post-vaccine reaction. Yeah,
Right. I
something.
think a lot of things we see with chronic Lyme and Epstein-Barr,
Hmm.
they're all activating the mast cells. So it's on one level, you want to stabilize the mast cells because they give a lot of annoying, uncomfortable, life-changing symptoms. But even more importantly, if somehow you can treat the underlying cause, well, that's a big win.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Are you concerned about your blood pressure? Join the millions worldwide who have chosen Kyolic as a natural alternative to support their heart health. Why Kyolic? It works. Over 900 published scientific articles and research studies have shown that Kyolic aged garlic extract has a positive effect on cardiovascular risk factors such as high blood pressure, cholesterol, circulation, blood sugar balance, and more. Kyolic aged garlic extract, organically grown garlic aged for up to 20 months for maximum purity and potency. Gentle on the stomach, easy to swallow capsules with no offensive garlic odor or taste. Visit Kyolic.com. That's KYOLIC.com. Learn about Kyolic Formula 109 for blood pressure, as well as Kyolic's other cardiovascular formulas. Kyolic is sold at Sprouts, Natural Grocers, Whole Foods, and natural health stores everywhere. Also online. Get Kyolic Blood Pressure Health Formula 109. It works.
Thanks for listening, and thanks for supporting our sponsors. They're what make intelligent medicine a continuing free resource to you. And now back to today's guest, Dr. Dean Mitchell, author of Conquering Candida, the new 30-day protocol for restoring your microbiome and health. So when you treat allergies, I mean, conventional allergists believe that you can treat inhalant allergies with injection therapy, progressively higher levels of whatever it is that you're allergic to kind of acclimate. It's kind of homeopathic almost, like start with a very small
high
dose.
doses, but yeah.
The hair, it's like taking the hair of the dog that bit you in effect. And then, but in sublingual immunotherapy, it's a little different. You can be checked out in the office. You can be actually given slit that you can self-administer at home, right? It's safe to self-administer. So
right.
How does that work? And can it, is it potentially helpful for food allergies or for Candida or other things?
Yeah, really, I'm so glad you're asking me this because it's so important. I feel I'm so shocked that people are still going for allergy injections these days. I mean, I guess I'm sort of out of the mainstream, but it's coming around. I mean, for 25 years, I haven't given an allergy shot. I did the first 6-7 years of my practice, and then unfortunately, like every practice, when you're giving allergy injections, it could be very potent doses, and you could get actually anaphylaxis from the shot.
Sure, you have to have a crash card.
I know of a couple of practitioners, even in New York, who lost patients who died from those shots. So that's what I wrote about in my first book, Dr. Dean Mitchell's Allergy and Asthma Solution. I talked about how my transformation, I was giving someone an allergy shot in the spring at probably a high pollen day, and she was dehydrated. I didn't know. She was drinking alcohol the night before. And she had an anaphylactic reaction. I went with her to the hospital, and thank God she pulled through. But it changed my course of my career. I said back in 1998, I'm not doing this anymore. Mm-hmm. And I was just really fortunate. I found out about a doctor in the Midwest, Dr. David Morris, who was doing sublingual drops. And he was a really brilliant guy. He was a very unusual guy. He'd been working with doctors in Europe who were doing the sublingual. So I went out to train with him, and I came back and I started doing that. And I've been doing that for over 25 years. And now the last 8 years or so, I've been doing it for foods because, again, I was waiting for all the research to show that it's effective. So to explain why, and why I think it's such a great option, is several things. One, when you're desensitizing somebody, it's actually good to do it gently and gradually. Okay. And this was something funny also I learned at a conference. I'll never forget. It's really one of the big academic allergists was teaching, and he said at the conference, he asked the whole group of allergists at one of the conventions. He goes, do any of you know why allergy shots are given once a week? And everybody kind of turned to each other and said, no, I don't know why.
Because that's all the patients can afford?
Well, that would have been a good option. He goes, the clinic in England that started doing it was only open once a week.
There you go.
Because when you desensitize somebody like we do in the hospital, it's good to do it on a daily basis.
Mm-hmm. Yeah.
Because that's really how you get the safest desensitization.
Yeah.
The other thing that we've really learned over time is that giving small amounts, but cumulatively, like what I do with the drops, you're actually getting much higher dosages than the shots because you're getting it every day. So it's a cumulative dose. But since you're getting a little bit each day, it's very safe. I mean, thank God in my 25 years of doing drops, I've never had an anaphylactic reaction. I mean, the most I've ever had is some itching in the mouth, a little bit of a rash. So it tends to be very safe. And I've had great success, desensitizing a couple of veterinarians that were allergic to cats, dogs, and horses. I've done people that had terrible pollen allergies. They couldn't go out and play golf or tennis in the spring. So there's really a huge variety that really makes a difference, gets them off of antihistamines, just gets rid of the inhalers for asthma. So I've always enjoyed doing that. And the last 8 years, I've really enjoyed doing the sublingual drops for foods. That's a little bit more tricky, but what getting good at this, and Dr. Edward Kim, who I've had on my podcast, who was originally at Duke and now at North Carolina, has shown that by doing this, you can protect people. Like, for example, a child with peanut allergy, in some of the cases, could tolerate up to 6 or 9 peanuts. Now, my goal with the drops is not for my patients to go out and eat peanut butter and jelly sandwiches.
Right, because these are people with life-threatening reactions.
Yes, right. So my goal with them is so that they could go to a party, a wedding, a bar mitzvah,
and not be afraid that there's like a peanut aroma, because they're actually
or not
peanut-free zones, in schools, and they don't serve peanuts on planes anymore because they might get into the system.
I had a 15-year-old who I've been treating the last year, has been doing great. When he was 14, he went on a class trip to South America, and he had severe peanut allergy. And by accident, someone in a cookie or something gave to him. He was intubated in, I think it was Colombia. His mom had to fly down there. They had to bring him back to the United States, and medevac him.
Right.
And you go through something like that, you're like, and I'll tell you something, I admire my patients with the food allergy. I mean, I think I'd be petrified to eat out anywhere.
Yeah.
So I think this gives them that extra reassurance, and just something that we can do for many food allergies, and I can do even for multiple, because it's kind of rare for someone just to be allergic to one food. Usually they have multiple tree nuts. It's just, and again, I think it has to do with antibiotics. People sometimes ask me too, why are food allergies so prevalent? And I really think that there's a lot of evidence pointing to the microbiome changes. That's why
you anticipated my question. I was just about to ask you, why is it that allergies are so prevalent? We tend to see less in the way of allergies in indigenous cultures.
Exactly.
We see them less in people who grow up on farms, who have contact with the soil and with barnyard animals, domesticated animals. And so what's going on? It's the microbiome to some extent.
I think that's the biggest thing, and there have been cases too, very clear cut to me. Like sometimes I have to be very gentle about this, but sometimes I'll have a mom that will come to me and bring their child, maybe might be their third child, who's got severe like tree nut and peanut allergies and everything too, and they're like, and their other 2 kids are fine, and I'll gently get a history like, was he on antibiotics the first year of life? In some cases, yes. Was the mom on antibiotics during pregnancy because she had an infection? And I've had cases like this.
So also we've seen a turnaround in the advice, and you're well aware of this, is for a while they said, you got to hold off on these problematic foods for infants and toddlers. We have delay their exposure to these things. Now they've done a 180 on that. And that actually is something that's been part of the messaging by Dr. Marty McCary. He wrote about it in his book,
yes, that's right,
which is about medical groupthink, is that, we thought that the best way to prevent allergies was to withhold these foods. It turns out that small amounts of exposure early in life can condition the body to become more accepting of these foreign proteins.
Yeah, it was interesting. Over the last 10 years, there's been a big change in the allergy community about advising parents, not to avoid peanuts. A lot of this is credit to Dr. Gideon Lack in England. And it was really funny, actually, how he discovered this. And he's a very top researcher in England in allergy immunology. And what happened was he was giving a lecture in Israel at the time. And he asked a bunch of the pediatricians, because they don't really have like allergists there. And he said to them, how many of you have kids with, peanut and food allergies? And very few raised their hands. And he was like, that's strange. And he ended up finding out that he felt from talking to them that a lot in Israel, apparently, the moms feed the infants very early on something called bamba, which is like a peanut paste. And so he says, okay, let's figure this out. He goes, let's take a Jewish population in Israel, England, and New York.
At Scarsdale. Yeah, right.
Yeah, right. And sure enough, they found out a huge discrepancy, and it seemed to be due to the later introduction of these foods. And as a result of that, now it's a little bit tricky though still, because you want to make sure you got to identify the family, you got to make sure the kids are not too allergic yet.
Yeah.
But it is something that they're trying to cut, and peanut allergy has gone down, fortunately, in recent years.
So, Dr. Mitchell, what's your take on some of these new powerful monoclonal antibody medications that are now available to allergists, immunologists? Maybe some of your colleagues are saying, why are you going through all this rigmarole with your patients when you can simply put them on these powerful drugs that suppress atopic dermatitis and that can suppress asthma and completely knock out the IgE that is responsible for allergic reactions? So do you have a light hand in prescribing those, or do you still find that there are some cases where those are useful?
I'm very selective. I think, like you, Dr. Hoffman, I like to be I'm very risk assessing in my practice, in the way I do things. And sometimes they can be valuable. I'll give you an example in a second, but I don't want anybody on a long term on these powerful medications. It can't be risk free. So to give you an example, I guess the best way I could describe it is if I thought I could desensitize somebody, for example, just using my sublingual drops, which are basically natural, really no long-term side effects, I'll just go right ahead and do it. If I have a patient, let's say with a food allergy patient that's really severely anaphylactic, I might use as a bridge for a few months something like Xolair, which blocks down the IgE, so I can do the drops at the same time without reactions. So I think these drugs are amazing, but I don't think they're, it shouldn't be a lifetime solution, because also once you stop them, the protection ends.
There's a rebound, yeah.
Well, it ends. The protection, ends. 2 months, you're back where, because when we do these sensitizations, this could potentially be a lifetime protection.
Yeah. Good stuff. Well, it's certainly, I will commend you because you are using an all of the above approach. You're accessing your excellent background in academic allergy immunology, but also thinking out of the box to find innovative solutions for your patients, with the premise being low-tech, natural as the first option, but obviously, with the backup of using modern medical techniques. So we call that on this program intelligent medicine, and you certainly fit the description. So anything else to add? And let's once again, we'll talk about the book. The book is Conquering Candida, the new 30-day protocol for restoring your microbiome and health. And it builds on the insights in your previous book, which was the allergy and asthma solution. And you have an upcoming book. Good luck on that, because, it's an arduous process writing a book, but you've got fire in the belly to talk about MCAS, which is a fascinating subject, and you're going to break that down for readers. So, and also, you have a website for your practice?
Yeah, it's Mitchell Medical Group. I think a lot of people are interested. They can find out a lot about the different things that I treat, and I really appreciate having me on. And like yourself, I love doing my podcast, The Smartest Doctor in the Room, because when doctors talk to other doctors, usually good things come about.
I loved meeting you because, this is one of the fun parts of my job as a podcaster, is I get to meet luminaries in the field, and you're my neighbor here in New York, so I hope our paths cross soon. Thanks very much for joining us, Dr. Dean Mitchell. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. There were many important reasons why I started my FullScript online supplement dispensary. I wanted to offer you the same curated professional-grade supplement brands that I use, the ones I know and trust. I also wanted to ensure that they weren't counterfeit or expired. Recently, I've been hearing more and more about counterfeit or expired products purchased from online retailers. With FullScript, you can be confident your supplements are genuine and they'll arrive with optimal freshness and potency. Also, buying through FullScript offers fast, free shipping, optional refill reminders, and a highly rated mobile app. It's safe, secure, HIPAA compliant, and offers world-class support. Go to drhoffmanstore.com for more information and to start your free FullScript account. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. To get started, just go to drhoffmanstore.com, drhoffmanstore.com.